Okay, so my first question is, how long have you been doing physical therapy?
So I've been practicing in Maryland for 2 years, and I've been working at Sinai Rehab in the orthopedic rehab unit for those 2 years.
Okay. Oh, and since you're working in Sinai, and Sinai is a hospital, correct?
Mm-hmm.
What made you choose working at a hospital over than working at like a smaller private unit?
That's a good question. I actually, during our schooling, we have different clinicals that we have to go to. So I had 4 8-week rotations at different places. So my first 3, I had a little bit of experience with outpatient clinics, which is the things that you're referring to. And I actually thought that's what I wanted to go into. I wanted to do outpatient orthopedics, mainly sports. And then my last clinical, I was in a hospital setting and a rehab setting like I'm working in now, and I figured out that I actually like that just as much as I like being an outpatient. So I came across the job that I'm at now, and I figured it would be a good place to start, trying to get to see a wide variety of cases, just to kind of get my foot in the door and then get experience that way.
Okay, that's good. So I'm going to ask you a few questions concerning my research topic about ACL injuries.
Mm-hmm.
So the first question is, in your experiences working with patients, have you noticed that they often re-injure themselves in the same area concerning the ACL?
I would say there are a few that do come back with re-injury.
Mm-hmm.
A lot of times that is because they went back to their sport too soon and did not do like the full recovery process, or weren't strong enough to really be back into their sport.
Yeah. Is the recovery process about like 6 months?
Yeah. So I know with return to sport, they usually say it is about 6 months. If you were just to try to get back to just doing everyday things, it's usually about 4 months before you have the full strength and kind of feel like 100%. But it's a little bit longer if you're getting back into like an aggressive like sport.
Yeah. And my second question is, although it may take some time for an athlete to return to the field once they have an ACL injury, have you noticed when patients do exercise at home, they reach a more speedy recovery, or is it better for them to leave the exercises to the therapist in order to avoid re-injuring themselves or pushing themselves too hard?
So another good question. So it's a little bit of both. So when you go to outpatient therapy, usually the timeline that you have therapy, it starts off like 3 times a week, and then you progressively go less frequently. So on those days that you don't go, your therapist most of the time will have you do a home exercise program. So the exercises that you start in the clinic, you carry over at home as well. Okay. So it'll be guided by the therapist, but it's a lot of responsibility for the patient themselves because they're only coming into us 2 or 3 times a week. That those other days that they continue to do those exercises to get stronger.
Yeah. So it's better. So like physical therapy is like the main thing, but also doing the exercise at home is essential for progress.
Exactly.
Okay.
Because unfortunately, if we could have people in the clinic every day, it would be great, because then we'd be able to watch and see how they're doing and kind of progress them maybe a little bit quicker. But it's very much dependent on what somebody's going to be doing in the times that they're not in the clinic too.
Yeah. My third question is, the research I found indicates that an increase of ACL injuries amongst women are due to factors they can't control, such as hormones and bone structure. Do you agree? Do you agree? And why do you think this creates such an inclination?
So I agree. I also think there are other factors that are involved too. Mm-hmm. Our bone structures, and I think they're referring to probably the hips being a little bit wider than males. But that combination with the fact that a lot of times young females have weaker hips. Well, they call them hip abductors. So they're the muscles that are on the side of our hips. So if those are weak, it ends up putting us in a more prone position to tear ACLs. So the factors like hormones, yes, those also can lead to reduced strength in our ligaments, but it's also a strength component too, because they've found that by strengthening those side muscles on your hips, it can lead to better alignment, and it can lead to putting you in a better position to prevent a future ACL tear, or even prevent an ACL tear to begin with.
Yeah. I also heard that that your intercondylar notch has like a play with that too, that limits movement.
Absolutely. And that again goes down to your just the alignment of your body. The intercondylar notch is a little bit narrower, so it's more at risk for tearing when you have those sharp movements.
Yeah. My fourth question is, in one of my sources, it states that women are more at risk for ACL injuries when participating in a sport compared to men because they start playing at competitively at a later age. Therefore, their muscles may not be as strong if they want to play at a competitive level. Do you think the age at which a person may start a sport could affect their bone development or cause later injury?
I definitely do. And it also just comes down to kind of the strength training that goes into before they start playing too. Because if someone comes into the playing, say, soccer at a later age, if they do strength training in preseason and throughout the season, hopefully they can start to gain strength, which would prevent ACL tears. But comparatively, if someone's been playing for multiple years, they may be weaker. It's not. I don't know if it's 100% correlated to not playing sports, but if they're not strengthening or actively strengthening, especially those hip abductors, they are probably at an increased risk for ACL tears.
Yeah. So, like, if someone, like a girl were to start, like, soccer at, like, 8 and the boy was doing it at 4, the girl would still be more at risk?
It's hard to say, because I don't know if many studies have been done specifically looking at, like, different ages and at what age you really start to gain muscle. And enough muscle to compensate. But going off of just kind of my thinking, I would say yes, but I'm not 100% sure on that. I don't have anything to really back it up, unfortunately.
Okay. And my last question is, research has been done on whether there's a difference in muscle strength among women and males and females after ACL reconstruction surgery, and they have found that there isn't much of a difference among both genders. Do you find this to be true as well in your experience?
So I would say it's another one that it's difficult because it depends on the person and how long that they've been playing the sport prior to this or how active they are prior. I would say typically from what I've seen, and the population I'm dealing with now, I don't get to see that many ACL tears. But in my other clinical experiences I have, and I would say generally my experience, I found that the men did tend to be a little bit stronger. But the women were able to gain strength while they were in therapy. But I would say initially coming into the therapy after the surgery, men tended to be a little bit stronger.
Yeah. I also have like a question concerning like physical therapy as like a job field. So like what influenced you to do physical therapy? Like did you participate in sports or anything?
Yep. So I played sports all my life, and then my junior year in high school, I had subluxed my knee. So I went to therapy for that, and that's how I kind of got interested in the field of physical therapy and kind of figured out what it was about. And then I did a little bit of shadowing experience and got to kind of know what the field was about from there. And then also through, once I was in college, in the program, doing just having the different clinical experiences, then I was able to kind of narrow down what I was interested in versus not interested in, because there are a lot of different settings that you can practice in.
Yeah. Well, thank you so much for taking out your time. I really appreciate it.
Yeah, absolutely.
Thank you.
Yeah, you're welcome. And if you have any other questions, feel free to call me back.
Okay. Thank you. Have a nice day.
Thank you. You too. Bye.
Bye.